A new report from the Seattle Times suggests that chemotherapy might be killing health workers. Chemo is poison by design. It's descended from deadly mustard gas, first used against soldiers in World War I. Thousands of healthcare workers were chronically exposed to chemotherapy agents on the job for years before there were even voluntary safety guidelines in place. Now, some of those workers are being diagnosed with cancers that occupational health specialists say could be linked to exposure to those same powerful drugs that have saved hundreds of thousands of patient lives. An Investigate West investigation has found that the Federal Occupational Safety and Health Association does not regulate exposure to these toxins in the workplace, despite multiple studies documenting ongoing contamination and exposures. Studies as far back as the 1970s have linked increased rates of certain cancers to nurses and physicians. Occupational health experts believe that's because when nurses, pharmacists, technicians, and increasingly even veterinarians mix and deliver the drugs, accidental spills, sprays, and punctures put them in close, frequent contact with hazardous drugs. A just-completed study from the U.S. Centers for Disease Control, 10 years in the making and the largest to date, confirms that chemo continues to contaminate the workspaces where it's used and, in some cases, is still being found in the urine of those who handle it, despite knowledge of safety precautions. Chemo agents have been classified as hazardous by OSHA since the mid-1980s. Hazardous drugs are those known to or suspected to cause cancer, miscarriages, birth defects, or other serious health consequences.